I would like to mention to the people of the state of Goa and the citizens, because there are several contradictory reports that are coming in the media about non-availability of medicines that are required to deal with COVID-19. I would like to share with every citizen that the Chief Minister and this government is a responsible government. I would like to also mention that my colleague Mr. Cleophas, he is also now stable. He is on assisted breathing, but he is absolutely stable. Whatever treatment needs to be given is being given to him, and every citizen and every patient is being given the same VIP treatment that we give any individual. Everybody is being treated the same way. What we are trying to do now, I would like to share with you a couple of details, is that we had already put a request for Remdesivir. Remdesivir is a medication. I hope I am able to pronounce it properly so people can understand. And tocilizumab is another medication which is generally given during the first cytokine storm. And these are all technical terminologies which I would like the people to understand. We've asked for 100 of the tocilizumab, this medication. One of each costs around 40,000 rupees. The government is already in the process of procuring the same. As far as the Remdesivir vials are concerned, we already have 30 vials with us. It is generally given between the 5th and the 8th day to the patient, and based on the protocols laid down by All India Institute of Medical Sciences. As far as my colleague Cleophas is concerned, and also many couple of other patients are concerned, we already took a proper update and a protocol from the director of AIIMS, Dr. Guleria, who the chief active involvement in seeing that we are able to get these medicines which are in short supply. Remdesivir is a medication that we have asked for we had asked for procurement more than about 15-20 days back, but this is not readily available. So we have put in a requisition for 1,000 vials costing about 35 lakhs of rupees. So approximately we are looking at about 3,500 rupees per vial. Money is not where we are going to compromise as far as the government is concerned. With one vial of Remdesivir is basically, it can be used for 6 patients. So I would like to say that we have got about 30 now. So about nearly about 180 patients we are able to deal with at the moment. Meanwhile, more stocks are on the way. The FDA director Goa has been asked, and secretary is personally monitoring. Secretary Neela Mohan is personally monitoring getting more vials of Remdesivir for the allocation for the state of Goa, because we have to see how much we need and how much we take, because the expiry of this particular medicine, this vial, is only about 3 months. So we are trying to see how best we can get it and how much we are able to see, because all over the country we need to use it. I would like to share with you that we are also exploring another position of one agency to manage the COVID care center. Secretary is working on a model so that, the food, each and every aspect of the patient, right from washing their clothes, laundry, housekeeping, utility. Today we have got an agency called EcoClean. We have got another agency which is also on board, which is going to be, we are trying to see whether they can provide all the nutrients, food and all that is timely arrival of food to the patients, which is also very critical and important, right from the COVID care centers to the COVID hospital. We are managing this whole thing through dashboards, which is very professional. I would like every citizen of Goa to believe in us, believe in the system, believe in what we are doing, and we are taking everything. And the health ministry is proactive, and I am very proud to say that we got a very good team under our Secretary Health. And also, what I would like to share with all of you is that the Secretary Health has been doing a fantastic job, and we are both working as a team along with her, the Dean Goa Medical College, Dr. Bandekar, Dr. Disa, and Dr. Ira, Dr. Edwin, and we are also creating more teams. At the moment, Dr. Sunanda Amonkar is managing the COVID hospital in Madgaon, who is doing a phenomenal job and managing all the patients. And let me tell every citizen of Goa, every patient, whether it's rich, poor, whether it's a legislator, all of them are equal to us. And the same attention and same care is being given to each one of them so that they recover fast. I would like to appeal to all the media is not to get carried away with various type of statements that come across, because many people don't know what we are actually doing, what is our stock position. And if there's any clarification, people can WhatsApp me. I will be happy to reply to the WhatsApp. We are a transparent government working in a very transparent fashion. The health ministry is working transparently to see that we save the lives of people of the state of Goa. We are also trying to make these rapid tests much more accessible. The secretary, I have already given her a note saying that the nasal swab, which is approved by ICMR, to explore it so that we are able to do more testing, and containment zones and other areas we can use these testing facilities, and this is something that we would like to do. I would like to appeal to every citizen not to get carried away to false propaganda, believe in us, and I can assure you that I have already made a pledge that we and our team, we call it Team Goa. all of our past patients. And I would like to also share with you and appeal to you that, we are trying to start plasma banking. People who have got cured from COVID-19 and 14 days after that, that's totally about 28 days. After 14 days, who gets a negative report, and subsequent to that, another 14 days. Or basically these convalescent patients who are there, who have recovered from COVID-19, their plasma is something very important. My target is about 2,000 packs to be stored in Goa Medical College. As we speak, we are recruiting, we are in the process of recruiting from All India Institute of Medical Sciences and another doctor who has approached us for, who are MDs in transfusion medicine. We are trying to get the best expert technicians. The apheresis machine should be in place in the next 2-3 days. And also this medication which I talked tocilizumab is very difficult to pronounce. This is a new medication which we are also in the process of acquiring and getting, which costs about 40,000. Basically, for the first cytokine storm, basically to save the lives. We are doing everything that it takes to save the lives, and we will continue to save the life of every Goan and every patient that is admitted in the COVID care hospital or in the state of Goa who gets infected with COVID-19. Trust us, believe in us. We are here to save you. We are here to control COVID-19, fight COVID-19 as a team. Team Goa united, together with the citizens of Goa who are coming forward and giving names of people who would be happy to donate plasma. I would like to appeal to each one of you, carry on this campaign, spread this message. This is the need of the hour. Thank you so much.